Today's podcast is going to be about pain with sex. Pain with sex due to fibroids. I touched on this topic in a previous podcast, but I'd like to circle back and spend a little more time talking about fibroids and pain with sex due to fibroids. Because if you're that woman having pain with sex caused by your fibroids, odds are you're not sharing this information with your gynecologist because there's several reasons. You may not feel comfortable talking with him or her. There just may not be enough time in a routine office visit to discuss such an intimate issue, or the doctor just seems rushed and not particularly interested in hearing what you might have to say. Another possibility is you're nervous. You're scared that the next thing the doctor tells you once you admit to having pain with sex due to your fibroids is that you need surgery. And to that, I want you to remember this. Not all fibroids require surgery. There are other options. Or maybe you have what we call superwoman syndrome, meaning that you think that you can deal with this all by yourself. You'll find a solution on your own. You don't need to talk to anyone. And until you find your solution, you're just going to deal with it. You're going to endure. And the truth is this, talking about sex can be very awkward. And a 15-minute office visit may not be the ideal situation to try to discuss. And maybe you will need to set aside an appointment just for that particular problem. Pain with sex due to fibroids occurs when a fibroid has gotten large enough to basically get in the way whenever there is vaginal penetration. Imagine if you had a fibroid in the back of your uterus or near the cervix, the opening of the womb, then whenever there is penetration, contact could be made with that fibroid, and that can be painful. The pain is very real. It's not imagined pain. It's not in your head. It's not psychological. It's due to distorted anatomy, direct contact with the fibroid causing physical discomfort. So it's due to altered anatomy. You may experience lack of desire or decreased arousal because of the pain. Because the pain is so debilitating. Lack of arousal or decreased arousal is secondary The pain with penetration is the primary reason for your discomfort, primary reason for your lack of desire, primary reason for your decreased arousal. Women have often discovered that changing their position during sexual activity or changing the angle of penetration helps to alleviate or lessen the pain. Now, this doesn't solve the problem, and sometimes the answer is a medication or a procedure or a surgery, because left untreated, left unaddressed, this can lead to relationship issues, self-esteem issues, depression, and despair. Couple this with lack of conversation, lack of discussion, this could develop into a serious health concern. The best option would be to identify fibroids before they become a problem and address or treat them at that stage. Before you have the pain, before you have the decreased arousal, before you have the discomfort. The best idea would be to identify fibroids early. And more importantly, what I'd like for you to understand from all of this is that fibroids are very common, and there are many women with a multitude of issues secondary to the fibroids. It's not just abnormal bleeding. And if you are struggling with fibroids, I'm reaching out to you, and I want to say you are not alone. You are not alone. I am calling out to Black women because we are disproportionately affected by fibroid tumors. I want to hear from you. I want you to begin to share your experiences so we can have a better appreciation of what you are actually dealing with. And to achieve that, we are beginning by asking you to complete a 2-minute survey. The link will be below. I'm asking you to take the time, complete the survey, and then once you've completed the survey, share it with a friend, because odds are she may have fibroids too. Until the next time, take care.